Hi, I'm Dr. Charles Schof, owner of Mandeville Center for Dental Excellence, and I have a passion for full mouth rehabilitation. It's a comprehensive way to treat the mouth as a whole. It helps us restore form, function, and beauty, and kind of without getting lost or sidetracked. It keeps us targeted and focused, and we tend to get through the treatment quicker. So full mouth rehabilitation is a term used in dentistry where we take all facets of dentistry and we start with an end in mind. You know, a lot of patients come in and they'll have a problem with a tooth or two, and we'll just kind of focus on that. And there's really not a need. Full mouth rehabilitation is for patients who have ground their teeth down, who have bite problems, who have lost teeth. Teeth have shifted, segments of their jaw have shifted, they're missing a row or even a complete arch of teeth. And so, take a step back comprehensive approach. We use digital imaging, we do diagnostic wax-ups, we could do temporaries. Patients can test temporaries for a period of time so that we put the effort in to get the results that the patients want. So although the term full mouth rehabilitation kind of sounds, daunting or scary, the biggest part is just making sure that you find a practitioner or a dentist who has the ability to put the plan together. And there are a lot of times where you can phase the treatment over a period of time once you have the end in mind. So you could break sections up. There are times where, depending on how badly the mouth's broken down, it has to be done all at one time, but we try to the best of our ability to break it down in segments because it's easier for the patient. For the patients who have the ability to move forward, we certainly can phase the treatment quicker. For those who need a little bit more time because of schedules or maybe finances, there's the ability most of the time to break that down. I've spent a career putting together my education to be able to take a full mouth rehabilitation for patients and have it under one roof. And the core foundation is the bite, and I've had 30 years plus of rehabilitating patients, understanding the dynamics of getting the bite foundation correct, and then taking the other facets like surgery, orthodontics, dental implants, both placement and restoration, use of crowns, and other facets of dentistry to be able to do it all in-house. We're very efficient at what we do. If you think you're in need of a full mouth rehabilitation, I invite you to come into our office and let us evaluate what's going on. We have a lot of different solutions that are available under one roof, and I'm sure we can find the right solution for you. Some of the advanced technology we have for full mouth rehabilitation is we have in-office crown making machines, we have digital technology, we have scanners, we have the ability to do digital wax-ups, we have the ability to create mock-ups for patients, so we can give them a preview of what the end result would look like. I think some of the biggest benefits patients have after completing a full mouth rehabilitation is the ability to function properly. You can have aesthetics correct, but if the function is not correct and the bite's not correct, you will still continue to have problems to a point where you can actually damage the crowns or the veneers that you have in place. So, getting the foundation right, starting to get the bite right is paramount for the long-term success. I would say that if you're at a point where you're stuck or you're embarrassed or you really don't know where to begin, I'd invite you to come in and let's sit down and have a conversation. No judgments, and we'll sit down and we'll come up with a plan. Whether we, most of the time, if I could break it down to a smaller bites, so to speak, for you to accomplish, that's what we try to do. So, just come in. Let's sit down and talk and see if we can find an answer. So if you think you're a candidate for a full mouth rehabilitation, I invite you to come in. We'll take a scan. We'll sit down. I'll listen to what problems you have, and then we'll come up with some solutions. Probably have some cases that are very similar that I can show you some before and after pictures, and we'll get started in putting a plan together.